Welcome, everyone. We are so glad you could be with us today. My name is Ennis Baker, and I am the director of the ITI Care Project, which stands for Infant Toddler Trauma Informed Care. I'm going to put a link in the chat if you're interested in learning more about what we do. But my job today is to introduce our speaker. As a member of the trauma-informed care world, one of the things I always want to emphasize about trauma-informed practice is that it requires cultural humility and cultural responsiveness, as well as a commitment to promote resilience and equity. So it is such an honor to get to introduce Dr. Meek, and I've had opportunities to learn from her in the past, and I'm very excited to have another one. But before introducing her, I have a few words about logistics. Dr. Meek will be presenting for about 40 minutes, and after which we'll open up for questions for about 15 minutes. So please submit questions you have in the Q&A function at the bottom of your Zoom screen. And it'll also give you an opportunity, once questions have been submitted, to vote for them so that the questions that most people have will kind of rise to the top. So thank you for your time to share a question and also to share your thoughts about questions that other people have. So we'll jump in. The Early Childhood Initiative, established by the Center for Child and Family Policy, seeks to bring together scholars to address these challenges and produce world-class scholarship that helps maximize the potential of all children during the early childhood years. Speakers range across disciplines, but share an interest in bringing cutting-edge science to bear on policies affecting young children. And it is my pleasure to introduce Dr. Shantel Meek, Professor of Practice and the founding director of the Children's Equity Project at Arizona State University. The Children's Equity Project is a multi-university initiative that focuses on closing opportunity gaps and dismantling systemic racism in learning settings to ensure that children reach their full potential. Dr. Meek previously served as a consultant in early childhood policy and strategy at the Bipartisan Policy Center in Washington, D.C., where she advised senior staff on a range of federal and state equity and early childhood policy issues. She served in the Obama administration as a senior policy advisor for early childhood development at the U.S. Department of Health and Human Services, and as a senior policy advisor for education in the Domestic Policy Council at the White House. During her time in the Obama administration, Dr. Meek advised senior officials on a wide array of policy issues, including Head Start, childcare, public pre-K expansion, and promoting equity and reducing disparities across the early care and education system. Please join me in welcoming Dr. Meek.
Thank you so much for that kind introduction and for the opportunity to be here with you all today and share a few words about the work we do at the Children's Equity Project. So if you give me 1 second, I'll share my screen and get us started. All right. So you just heard a brief overview of the Children's Equity Project. This is our team. Just to reiterate, we're housed at Arizona State University, but we really operate as a network of scholars and advocates and other folks across the country who do work across research, policy, and practice on advancing equity. A lot of our work is in early care and education settings. We also do quite a bit in K-12 and other adjacent systems, including health, mental health, immigration systems, and so on. And we work across kind of all of the levels of policy, local, state, and national. So I'm going to start the talk today with a little framing from the Racial Equity Institute, actually out of North Carolina, right there in the area. And this is from one of their racial equity trainings. And I think it's just such an excellent grounding to jump into the work specifically about early care and education and the systems in which we all operate. Some of you may have heard this metaphor before. For others, it might be the first time. So just bear with me as we kind of walk through this. So imagine you are walking through a field, right? A really grassy field. It's a sunny day. You feel the sun shining, you see it, and you come across a lake. And you're admiring the lake, right? The shimmer of the water and the reflection. And then you look down and you notice that there's a fish floating belly up in the lake. So what's the first thing you would think, right? What would come to mind first? You'd probably start making hypotheses about what happened to that fish. Did that fish get caught on a fishing line or hook? Did that fish eat something? Was that fish just sick? What happened to this particular fish, right? And then you look up and you notice a second fish that's belly up, and then a third one, and then a fourth one in a pond, kind of walking around the whole lake. You notice that about half of the fish in this lake are belly up. Well, at that point, it's unlikely that you would be like, what happened to this fish and what happened to this fish, right? Individually, you would stop making those individual hypotheses, and you would probably start asking questions about what's wrong with the water in this lake that is making so many fish sick. So now imagine you walk past that lake and you keep going and you come across a second lake, and you notice another fish belly up. But then you look up and half of the fish in that lake are also belly up, right? You keep going, you come across a third lake, and then a fourth lake, and then a fifth lake, and it's the same pattern in all the lakes, right? At that point, you would probably move from saying, what's wrong with the water in this lake? And what's wrong with the water in this lake? And what's wrong with the water in this lake? And you would probably start to make hypotheses about what's wrong with the groundwater that's feeding all of the lakes, right? That's making all of the fish so sick. And so that's kind of a starting frame for how we think about how systemic racism is really embedded across our systems, across our structures in the United States, right? And it's manifested differently over time. So the Racial Equity Institute kind of put together just this graph here that what you're seeing is a whole number of different outcomes along the bottom there, along the bottom: health, education, criminal, child welfare, finance. And then the really small Black print are specific outcomes. So for example, in health, you have infant death or death from diabetes, right? And so on. And what you see graphed here is the likelihood of having a bad outcome compared to white people in the United States. So it's comparing Black folks to white folks in the United States with respect to a number of different outcomes. So the first thing you might notice, right, is that red line is kind of zigzaggy, right? So the difference in outcomes, right, those disparities, the intensity of those differs, right? Really big in the criminal and legal box, as you see there, smaller in some of these other ones. But you might also notice, right, is that the red line and the Black line never switch places, right? There's never a time where the red line goes below the Black line. It's consistently above across all of the systems and across all of the outcomes. And we think, and we believe what is driving that, right, as we'll get to a little bit in a second, is kind of the history in this country of exclusion, marginalization, exploitation, and violence that has manifested over time and is continued over time, and that continues, right, to manifest in different ways within our systems. So just a quick step back before we jump forward. We always like to start with this graph. Some of you may have seen this. This might be new to other folks. We often hear in our work, right, and especially now with critical race theory and like, why are we talking about, the history that was so long ago, right? When we step back and we look at the context, right, of the history of this nation and before the founding of the nation, right, we see that 88% of this timeline, right, is the period of enslavement and the period of legal segregation, Jim Crow era. Of course, it's not necessarily in the green since 1954 for sure, right? But if you even just looking at that, the explicit exploitation by law and policy, right, like written down, that has been the majority of this timeline. And so when we think about those outcomes and those systems that we shared a bit ago, right, many of those things are things that compound over time. Right? It's not like from one generation to the other, it just switches, right? Resources, wealth, right? Economics, health, even education, right? All of these things compound across generations. If you're in education research, you probably know that your mom's education level is one of the best predictors of the child's education level, right? So many of these factors compound over time. And kind of the last piece that I'll share before we jump into early care and education specifically is another really kind of telling study that was conducted several years back that used kind of monopoly as a basis to explore kind of this compounding effect that I just talked about. So what the researchers did is they invited a group of folks and they had a number of tables in a room and they had a game of Monopoly set up on each table, right? But then for each table, they divided it into 3 groups. So a couple people were in group 1, a couple people were in group 2, a couple people were in group 3. So every table had a group 1, 2, and 3. And then they said, you are going to play Monopoly, you're going to play a game of Monopoly. Everybody plays by the same rules. Everybody knows how to play Monopoly. The only catch is that group 1 gets to start at the very beginning and they get to play 7 rounds while group 2 and 3 sit out. And then after those 7 rounds, group 2 can come in. And then those 2 groups play 5 rounds. And after that, then group 3 can come in, but everyone's playing by the same rules, right? There's just staggered entry into the game. And what the researchers found is that the winner always came from group 1. That never changed. Group 2 and group 3 rarely built the same level of assets as group 1, if you know Monopoly. And discouraged by their inability to make meaningful progress, researchers noted a lot of kind of qualitative stuff that the late starters often wished to land in jail, made comments like that to avoid landing on expensive real estate that would continue to worsen their status in the game. So when we think about that, right, and think about the broader landscape of history in this country, when we talk about racial disparities in outcomes, right, really important to talk about them at their root. Like, why do they exist, right? They don't exist because Black people, other people of color, Indigenous people, Latinos, they don't exist because, folks are just, less good at taking care of money or less healthy or all these other pieces, right? They exist because of that historical marginalization, exclusion, exploitation, and violence that well before the founding of the nation, right? Beginning with slavery. And that is then paired with and compounded by, right, current marginalization, exclusion, exploitation, violence, and inaction, right? It never stopped. It just evolved, right? It looks differently. It's not written down explicitly. It's right. There's all these other ways that it manifests. And so part of the goal of the Children's Equity Project is to try to identify how systemic racism and other inequities are manifesting within our system, operationalize that, figure out what that looks like when we're looking in a classroom, when we're looking at a system, and then identify ways and policies that could help to roll that back and remedy those pieces. So building on this kind of just broader foundation, right? What is our role in cleaning up the water, in cleaning up the groundwater that is feeding all of our systems, including early care and education, including K-12 education, including health and mental health and all of these other pieces that we know are really critical to children's early development and family well-being. So back in 2020, which feels like forever ago, we published a report called Start with Equity, 14 Priorities to Dismantle Systemic Racism in Early Care and Education. And what we did was we tried to do what I said before, right? We tried to operationalize where some of the major inequities in early care and education exist, right? And provide some policy recommendations to Congress, to federal agencies, and to states to start making progress, right? Combating against those manifestations of racism. So the report had a wide number of authors and colleagues, including Dr. Iome Ruka from North Carolina, who's also hometown there, and a variety of other colleagues. And we published it in partnership with a number of national organizations, National Black Child Development Institute, Council for Professional Recognition, Ed Trust, and HSA, and others. And one of kind of the, I don't know if I'd call it a definition, but just kind of the way that we tried to conceptualize, all right, looking forward, how do we identify these manifestations and how do we operationalize where we go next and how we can break these pieces down? So to do that, we kind of thought through what does an equitable learning system, what are like the really high level dimensions of an equitable learning system, right? So what we kind of came up with was this: equitable learning systems provide access to resources, one, opportunities and experiences to children and families that result in positive outcomes that are not associated with children's demographic characteristics. They actively and continuously identify and intentionally eliminate manifestations of systemic racism and other forms of oppression. So the three key words in that piece, at least looking forward, right? It's acknowledging where we've been and the real compounded effects of where we've been. And looking forward, it's thinking about within our systems, what does access look like, right? Who gets in the door? Who gets access to resources? For who is it really easy to get resources? For who is it really hard to get resources? Who gets denied resources? From who are we withholding resources, right? Once kids and families are in our systems, in our programs, receiving services, what do their experiences look like? And how do those experiences differ, right? This gets into everything like the adult-child relationship, the teacher-child relationship, discipline practices, the language of instruction that we're using, and if that matches the kids in the classroom, right? If we're including kids with disabilities with appropriate accommodations fully and across the whole day, like it includes a whole lot of pieces that we already have a lot of data and research that shows that kids actually don't have the same experience, that there are kids from various groups, right, which we'll talk about and we'll dig into in a minute, that have different and worse experiences, right, associated with those demographic characteristics and the experiences they're getting because of that. And then the last piece is outcomes, right? What are the results of our access to resources and our experiences within our services and systems? And are we always looking at outcomes across groups, right? And if we're seeing disparities in those outcomes, right, how can we trace that back to the experiences that we're providing and the access that we're affording or not affording, or making it really easy or making it really hard to get? So from that kind of overall framing, we identified a non-exhaustive list of priorities that we could address to start to make progress on these issues and build a more equitable early care and learning system. I don't have time today, unfortunately, to go through all 14, so we're going to choose a handful or so to go through in a little bit more depth. But I will kind of read them out loud here. The first is allocating funds equitably. Where is the money going? Promoting authentic integration and holistic integration, right? What does that mean? Ensuring accountability for advancing equity for the workforce, ensuring that equity is centered in a core part, not a supplemental part of professional preparation and development, embedding equity in quality rating systems, requiring culturally affirming pedagogy and curriculum, embedding equity in global quality measurement, eliminating harsh discipline, protecting the rights of children with disabilities, implementing data-driven equity quality improvement, funding family leadership, prioritizing family childcare, and expanding access to bilingual learning. Again, this is a non-exhaustive list, but it is 14 priorities that we identified to move forward with. So I'll start with the first one. It's not an accident that it's a first one, where we say that they're in no particular order, but resources are important and are critically important, right? We know that today per child funding is inadequate in the vast majority, maybe almost all early care and education programs and in many K-12 schools. We know that the Education Trust does this review and looks at funding inequities in K-12 education, and that their most recent report from a couple years ago found that in many states and districts, wealthier, whiter schools receive more funding. Of course, it's a complex story when you get to K-12 because you've got the federal, state, and local funding. In some places, the federal is compensating, but in others, kind of the state and the local piece, it's not compensating enough to make up for those inequities. So it's a nuanced story. We know that in early care and education, there's been some research recently on tiered quality rating and improvement systems, or how providers get reimbursed at different rates based on what quality category they fall into according to the state. And we know that recent research found that majority Black and Latina childcare programs are rated lower in quality. And so as a result, we're receiving lower reimbursement, right? Creating this cycle of inequity. We know that layered on top of inadequate and inequitable general funds, right, is the chronic underfunding of targeted funding streams like IDEA or Title III for English learners, for example, Head Start. For example, IDEA, the Individuals with Disabilities Education Act. We know that the max federal share of funding determined by Congress, right, when they wrote that law, was 40% of the national average per pupil expenditure. That's what we consider full funding of IDEA. We know that Congress has never even approached getting close to this goal, right? And right now, federal government only funds about 18%, right? And so when you think about a budget reflecting our values and reflecting our priorities, right? You already set the bar at 40%, but we're at 18 and we've never even gotten close to 40%, right? These are manifestations of inequities, right? And so I would encourage you to check out the full report for our list of recommendations, but really kind of the top line here is, how do we consider historical and current marginalization and disparities in access to resources, experience, and outcomes when we're allocating money across the early care and education system. The next one I'll talk about briefly is equity in monitoring and accountability systems. We often talk about how equity needs to be operationalized like across the whole continuum, right? It has to be written into standards. Then there has to be some accountability and of course support, you know, and training and technical assistance and all of that. But so often what we found is that on a lot of these pieces that I'll talk about today and that I won't have time to talk about today, but we've written about, is that even where equity is encouraged, I'm saying that very loosely, but even where, for example, IDEA, right? Inclusion is clearly prioritized in that law, right? But the federal government doesn't count how well a state is including kids in its decision to continue funding that state, right? So the accountability was so often lacking, even when, you know, there were policies in there that disproportionately benefited, right? Kids from historically marginalized communities. And so unfortunately, right, that needs to be like from the good, it's not going to happen from the goodness of our hearts, right? There need to be standards and there needs to be accountability, right? And that those two pieces are also kind of a reflection of our priorities and our values. So if we say we want equity and we say we're committed to equity, it can't be an optional thing on the side, right? It needs to be part of the standard from the beginning. It needs to be part of accountability when we're moving forward. So last year we published a report called Equity is Quality, Quality is Equity, that really went through in a lot of detail and operationalized what equity indicators could be within quality rating systems, but it could be used for monitoring accountability standards and so on at the state level, at the program level, and it aligned with those 14 priorities. So across all of those, right, we kind of went through and identified, here's 10 indicators, right, that states can pull from that would indicate or provide evidence that they are doing a good job, that they are moving in the right direction for dual language learners, for example, that they're moving in the right direction for eliminating harsh discipline and disproportionalities in harsh discipline. Which brings me to harsh discipline. I didn't even know that slide was next. So the other piece that has gotten priority 9 in our report, a lot of attention in the last 10 years, I would say, is harsh discipline. And at the CEP, we think about certainly suspensions and expulsions, and that's where a lot of attention has been. We also think more broadly at other forms of harsh discipline, especially ones that are reflected in policy, including seclusion, which still happens and is defined as locking a kid in a room by themselves without the ability to get out. The inappropriate use of restraint, corporal punishment, also, which surprisingly, shockingly, maybe not, still happens in many states across the country. And so we look at the broader array of harsh discipline and focus a lot on suspension and expulsion in particular, because we have better data on that in the early years. So we have no evidence that it actually works, right? There's no positive finding that you will find if you scour the literature on if a child is suspended, this positive thing happens to them next, right? It's not good for the kid, it's not good for the class, it's not good for the system. There's no evidence that it works at any level with whatever it's intending to do. We have a lot of evidence, though, that it has negative short and long-term effects, right? We also know that it is driven by bias, which we might get into, I think we get into in the next slide a little bit. Misguided policies, right? Poor working conditions, lack of supportive resources, school climate, and other factors as well. We know that there are a handful of interventions, I would say less than a handful of interventions that have been found to decrease exclusionary discipline, but very few have been designed to, and as a result have demonstrated outcomes in actually reducing the disparity in discipline. So this might be a familiar chart to folks, but it's really showing the suspension rate for Black boys compared to their peers, and Black girls on the right-hand side compared to their peers. You see that in the case of boys, they're only 19% of enrollment, but 45% of suspensions in the male category. And for girls, you see an even bigger disparity with 20% of enrollment, but 54% of female preschool suspensions in the early years. We did an analysis in a report we published in 2020 that looked at, we used federal civil rights data collection data for that. So it's public pre-K programs through the elementary years. And we wanted to look at the disparity between Black students and everybody else, because they are so consistently and most starkly overrepresented in this particular area. And what we found, you'll see kind of the key on the left, there was a racial disparity in every single state in the nation, right? Those that are yellow, those I think 3 or 4 states there, had the lowest rate. Those were that are maroon had the highest rate, but the takeaway is this: it's everywhere, right? This exists everywhere. It exists across every time point we looked. It exists across states. It exists across types of discipline. And so I think this is maybe the most important slide of this section, right? Research shows that Black children don't behave worse. They don't have more frequent misbehavior. They don't have more intense misbehavior, right? Yet we have all these findings of being more likely to be suspended, expelled, harshly disciplined more broadly, right? We often hear this income thing come up with, oh, it's the fact that Black children are more likely to be in the lower income setting and that income is driving blah, blah, blah. Well, we also know that isn't the case, right? We know that if you compare a high income Black child with a high income white child, that high income Black child is still at higher risk of being suspended or expelled. And you can compare and control for income across, and we continue to find these disparities. My colleague, Dr. Walter Gilliam at the University of Nebraska, has done a lot of research in this space for many, many years. And he's identified what he calls 3 risks for being suspended or expelled in early childhood programs. And he calls them the 3 Bs. And those Bs are being big, right? So in a class where you're mixing 3 and 4-year-olds, the taller kids, the 4-year-olds generally, who are bigger, were more likely to be excluded. Black and boy. And so those 3 always stand out to me, right? Because whenever we think of suspension expulsion, our minds go to challenging behavior. How do we address challenging behavior? Which is a valid, like, it's important to address classroom management, challenging behavior, social emotional development generally, for sure. But what do those 3 B's have to do with challenging behavior, right? Nothing. What do they have to do with our perceptions of challenging behavior, right? Is it that we are seeing it more because we are scrutinizing, right, one group of children more than the other, because we're expecting it, because we have different expectations, right? What is driving that? And there's a whole lot of research that I don't have time to get into today that identify different forms of bias, right? Adultification bias, and so on and so forth, that kind of feed into this mismatch with Black kids don't behave worse, but we have this huge, stark, consistent disproportionality, right? What's in between those 2 findings, and what are the forms of bias that are driving those pieces? I mentioned restraint and seclusion. This is an area where children with disabilities are starkly overrepresented, right? This is K-12. They don't, Department of Education does not collect this for young children in pre-K, but it does for K-12. What we find is that K-12 students are only 12% of student enrollment, but 71% of those restrained and 66% of those secluded, which again is locking a child in a room by themselves without the ability to get out. Look at seclusion policy across the country. There's various variations of different limitations, but I think the one thing to point your attention to is that only those 2 little states in blue are the only ones that ban this practice, right? Everybody else has some variation of allowing it or disallowing it for certain kids or in certain instances. So back in the fall, last fall, my colleague, Dr. Rosemary Allen and other folks published this report that really starts to get at a more holistic approach to ending exclusionary discipline and disproportionality and exclusionary discipline for young learners, right? So often, again, as I mentioned before, we just jump to challenging behavior, social emotional, do the pyramid model, right? Or mental health consultation, or in lots of other cases, we had just put a policy in place, right? But either one of those by themselves isn't enough, right? As we've seen. A lot of the policy action that happened was good. Like, I'm an advocate of having these things in policy, but there wasn't the rest of the infrastructure in place to make sure we could implement that policy. And the vast majority, I won't say all, of the policies were colorblind, right? And what does that mean? That means that their goal was to reduce the rates. There was no language or wording in those laws, right, that talked about reducing disparities. And so that wasn't part of the intervention of those policies. And so as a result, when the next round of civil rights data collection came out, the latest round, which I believe was last fall, what we saw was that the rates of preschool suspension actually went down quite a bit, but the disparities remain the same. They didn't change. And that's because so many of the interventions didn't intend to change them, because we didn't word that in the policy or make that a specific part of the professional development systems. So I encourage you to check this out and read about that. The 10th priority is really looking at the systems, processes, and procedures around kids with disabilities, right? Addressing equity in early intervention and special ed. When we think about the special ed and early intervention system, there's kind of 5 areas that stand out as really important and as areas where we see inequities, right? When you look at the intersection between race and disability, for sure. And when you look at kids with disabilities more generally, when you look at the intersection of language and disability, you see a lot of inequities boil up. And so those 5 areas are identification. So what are the disability categories kids are getting identified with? And how does that influence, right? How is that influenced by, right, what those kids look like or sound like? And what does that affect later on the service delivery side? What implications does it have? Access. Who has access and who doesn't? We'll dig into that a little bit in the next slide. Inclusion, right? inclusion is a civil right. But we see that there are inequities in inclusion. Preschoolers with disabilities in particular are less than half of them receive their services in inclusive settings. And when you begin to disaggregate, it gets even worse. Quality and dosage of services, right? And here's where we think about kids' experiences with early intervention and preschool special ed and so on, right? Particularly for when we think about bilingual children with disabilities, for example. And if you think about how many early interventionists and early childhood special educators are providing services in the child's home language, right? Which we know is really important. So a lot of variability there. And then in outcomes, right? The outcomes that we're seeing for kids with disabilities. So real quick, I'm sorry for this very wordy slide, but we know that identification is a very complex picture for kids with disabilities when you're looking at the intersection of race, language, and disability. There's been quite a bit of controversy and scholars with differing opinions on what this looks like, but we know that depending on the group, depending on the disability, right, that there's underrepresentation in some areas and overrepresentation in some areas, right? And that both whether it's underrepresentation and overrepresentation in particular diagnoses or categories, both of those things mean it's not accurate, right? And so that affects service delivery and service quality and outcomes and everything down the road. I think one of the really important features here to think about is to think about the incidence of disability, the true incidence, and the documentation of it, right? And what the difference could be between those. So just a couple of examples we have here, right? We know that Black children are more likely to be diagnosed with, in some cases, disabilities that require more subjectivity in the identification process, such as emotional disturbance. When we look at inclusion later on, we see that kids with emotional disturbance are less likely than kids in other disability categories to receive their services in inclusive settings. So all these things kind of tie together, right? We know that English learners are often misdiagnosed because even though, right, in the law, you're supposed to ensure that the outcome of a particular assessment or evaluation isn't because of language, right? A difference in language, that it's a true disability, you're supposed to eliminate that potential. But they're frequently misdiagnosed because there's limited personnel who speak their home language and are trained to conduct valid assessments and evaluations, right? To truly understand what kids know and can do. And we know, of course, as I just mentioned, these misdiagnoses or these kind of misrepresentations across various categories, they have effects on where you get your services, what kind of services you get, how often you get your services, and so on. We know that access is another big problem. There's a well-established literature base that finds that early intervention is important. And the earlier, the better. Most of the folks on this call probably know the brain science, right? And how important it is to foster those early experiences. Similar for early intervention. We know that it's a critical time period, right? That it could really be influential in setting trajectories in the long term. And the pattern that we generally see here is that many children of color, and you'll see the breakdown specifically on the right-hand column, are underrepresented in the early years in that Part C and Part B 619 section, but then they're overrepresented once you get to the K-12 years, right? And for white children, it's the opposite, right? They're overrepresented in the early years and then less likely to be less represented in the K-12 years, which is actually the pattern you want, right? We want to address issues and provide supports as early as possible. And so the issue of access in general, particularly in those early years, is another issue. When we talk about inclusion, it is this long definition of inclusion that was published in a policy statement from the U.S. Department of Health and Human Services and Education back in 2015 during the Obama administration that really tries to move beyond conceptualizing inclusion as like the physical placement of like where the physical placement of a child is, right? It really gets at this holistic view of inclusion, right? that they are learning alongside their peers, but that we're providing appropriate accommodations and services and supports across all of the learning and social activities going on in the classroom, and that it really applies to kids with disabilities, from those with the mildest, those were the most significant needs, right? There's not a bad candidate, right, for inclusion. And so really thinking about it as that broader perception. So what do we know about inclusion? We know that there's a really strong research base that finds that kids with and without disabilities benefit from inclusive learning opportunities. Despite a really strong law that clearly prioritizes inclusion and providing services in the least restrictive environment, we know that progress has been really slow in increasing the number specifically of preschoolers who are receiving their services in inclusive settings. The number has edged up by maybe 5% or less within the last several decades. And then we backslid during the COVID era, and now are kind of worse than we were before. We know that inclusion varies by disability type, by age, by race, by location. We know that we're actually doing a really good job with infants and toddlers in terms of getting their services in the natural environment, because the natural environment is over 90% of the time that's at home, and that's what those services are built around. But once they turn 3, right, once they get into that preschool system, it's less than half of preschoolers. And again, since the COVID years, it's well under half of preschoolers are receiving their services in inclusive settings. We know that there's been a lot of research on the different barriers to inclusion, including ableism, which are really the attitudes, differential attitudes, expectations, assumptions that whether policymakers, teachers, or other folks in between make about children and people with disabilities. There's a lot of perceived policy and financial barriers. There's a lack of workforce preparation and support for general early educators, and a lack of kind of coming together and coordination of kind of the early ed system with the early intervention and early childhood special ed systems. Again, I mentioned this as an example of lack of oversight and accountability early on, but it is not something that states are they are monitored on it, but that does not count for their redetermination to get more money. So again, that accountability piece is missing. And we also know that public pre-K expansion has not resulted in also more inclusive slots, right? And it's a very underutilized tool to expand inclusion. Part of the reason why these segregated self-contained preschool special ed systems exist, right, is because they IDEA predated, right, a lot of the movement in expansion of public pre-K across states and communities. But as public pre-K started to grow and expand, instead of kind of bringing those systems together to provide inclusive experiences for kids with disabilities and kids without, kind of in many places, these two systems continued to just operate separately. And that has continued to happen, even as we've grown, right? There hasn't been meaningful expansion and inclusion, at least proportionate with the growth that we've seen in general public pre-K. We know that it varies across the country, with Colorado, Nebraska being really high in terms of the percentage of kids with disabilities who are getting their services in general early ed programs, to Louisiana and Alaska, South Dakota on the low end, less than a quarter of kids receiving their services there. So what can we do here? I'll share the links to all of our reports with all of our specific recommendations, but part of it is understanding where your gaps are across those 5 areas, right? Identification, access to services, dosage and quality, inclusion, discipline, right? As we saw, kids with disabilities are also over-disciplined. Identifying where those segregated preschool special ed programs continue to operate, right? In the state, and really investing in meaningful structural reforms to expand high quality inclusion, to bring those systems together and create more inclusive slots. Ensuring, as public pre-K continues to grow in states and communities across the country, ensuring that all of those new preschool programs, right, that inclusion is a core standard, right? Ensuring that our workforce, diversifying the workforce, including linguistic diversity, as we talked about earlier. and really using data to deploy TA and support to districts and communities with the largest disparities, the largest kind of segregation of kids with disabilities. So this is the last segment I'll talk about before we jump to questions. And I'm going to focus on dual language learners and really thinking about what access looks like for them to dual language learning. So just a brief overview to start, right? We know that there are about 11 million, or a third of kids under 8 who are dual language learners. In some states, the numbers vary a lot by state. In California, it's over half of the kids. We know that English learners, which is the term that we use for kids, once they kind of take a test and are designated an English learner and are, have the right to services from kindergarten up, we know that that is about a little less than 10% of the K-12 population, with larger numbers in the early grades and smaller numbers as you go up. We know that major data gaps exist, especially in the early childhood years. We know that DLs are diverse by basically every measure, right? Across incomes, across immigration, across race, across, region, across the country. We know that DLs are really a highly diverse group. We also know that they have cultural, linguistic, and cognitive strengths, right? Including cognitive advantages associated with bilingualism that I'll touch on just a little bit. In terms of kind of the research on approaches and models to best support DLs in early childhood and in K-12, we know that both these groups, and of course these groups overlap, but DLs and ELs do better in high quality dual language or bilingual models compared to English dominant models. But we also know that in many places, not everywhere, we have limited data showing, preliminary data showing that English learners may be underrepresented in dual language models. And it's a really different story regionally when you start to look at it. We know that segregated learning is harmful and ineffective, and that it has been just a part of practice and operations with these kids for a long time. That is also rooted in history, which I'll touch on really briefly. And I know we have major gaps, right, in child and global classroom quality assessments, and really truly understanding what is a quality experience, what is a quality program, what is a quality classroom teacher, et cetera, practices for kids who are dual language learners, and how do we best capture what they know, what they can do, and how we can support them. So to start, right, we know that we see bilingualism or multilingualism as a superpower. We know that infants are born with this capacity to learn an unlimited number of languages. What's required to learn those languages, right, is just high quality exposure to that language. We know that there is a whole body of baby bilingual brain research, as we call it, that have kind of looked at advantages in bilingual babies in really early childhood, really thinking about in problem solving, executive function skills, attention shifting, perspective taking, self-regulation. Looked at a number of kind of these executive functioning skills, comparing bilingual children or kids who are exposed to more than one language versus kids who are exposed to only one language. And part of the reason that one hypothesis, at least, we still don't quite understand like what those neural pathways are that are contributing to these differences. But one hypothesis that has been given is really the fact that in bilinguals, right, for every interaction, every verbal interaction, right, at least, you have to suppress one language and then express the other language. It's kind of like a brain exercise, right? And it is an exercise that bilinguals have to engage in every time they speak, right? And it's something that monolinguals don't, right? Because there's generally just one language to express there. And so some folks have hypothesized that perhaps this practice, right, this continuous exercise of suppressing and expressing and switching back and forth, and if you are bilingual or live in a bilingual household, you know that we kind of dip in and dip out of languages in the same sentence sometimes, and depending on who we're talking to. So that can contribute. What do we know about instruction, though, to really promote and foster this bilingualism? We know, as I mentioned before, that dual language immersion or really instruction that is provided in 2 languages, with the goal being bilingualism, biliteracy, and holistic kind of academic and child development, is better for kids. We find that kids who are enrolled, DLLs who are enrolled in these types of bilingual models, become proficient in English more quickly. They outperform their peers in math and reading. Some studies have found in Portland, they did a really rigorous experiment and found really promising outcomes. We know that kids reach academic norms faster. And of course, you have the benefit of being bilingual and keeping your bilingualism. I can say, right, as I'm 2 generations out from my grandparents who immigrated from Mexico and was very lucky to be raised in a very bilingual community, a very bilingual house, a very bilingual family. I was one of the lucky ones that got to keep it, but so many of our kids start school and then it's just 100% English, all, 6 hours a day, 8 hours a day, however long the school day is, for years and years and years, right? And you lose it. And you lose proficiency in it. And that doesn't just have, detrimental effects on your job prospects, right? It has detrimental effects on your racial socialization, on your connection to your family, on the connection to your culture and everything else. So despite all this research, right, bilingualism is great. It's like a really good thing, and dual language immersion and doing instruction in the home language is really great, and it results in all these benefits. That is not the reality for most DLLs in this country. What we find is that instruction across ECE and K-12 is primarily in English. Where the home language is used, some research has found it's been used for behavioral support. And part of this is because there is an overrepresentation, I should say there's an underrepresentation of bilingual lead teachers, right? And so they're overrepresented in assistant or aid roles, right? Which are less likely to do instruction and more likely to kind of assist with the behavior, with the social emotional pieces. We know that exposure to the home language goes down generally as children grow up, and kids are more likely to have a provider who speaks the home language in non-center-based settings. Though we should say that bilingualism doesn't equate necessarily dual language instruction. So I definitely don't have time to go into all of this history, but we should know that the kind of English as the default language in US schools is also part of a racist structure in the United States, right? That language has been used as a tool for exclusion, right? And they were literally called Mexican schools back in the day. And there were court cases that were brought, right, to combat those pieces by Mexican families in California in particular. And there's lots of research that says that segregation is really bad, right, particularly for ELs, and that the degree of segregation is actually the greatest predictor of disparities in achievement between ELs and non-ELs, right? And I think I'll just highlight that last little bullet point at the bottom, which I think is really interesting and goes toward kind of our sentiment for bilinguals in this nation. In multilingual societies, which are many, right, across the world, we're an exception, the achievement gap or the difference in outcomes between native speakers of whatever language that country is and their peers is small or non-existent, right? You don't have this massive gap like in the United States, where in Arizona, well less than 50% of English learners are graduating on time compared to, much higher numbers of non-ELs. So I don't think I have time to go with the rest of these. I would welcome you to check out the rest of our reports, and I will end on this slide that really kind of focuses on ensuring that change is systemic, that it's actionable, right? That we're not just saying equity all the time, that we are defining what we mean by it, that we are measuring it, that we are building accountability and support systems specifically to advance it. And that it is really happening across the board, right? The disparities and outcomes that we all know about, some of which I've talked about, right? They're not a foregone conclusion. They're not baked into us as people, right? They're choices. They're choices, right, that have been made through policy, through the allocation of money and resources and opportunity across the history of this nation and that continue today, right? And that means we can change it. So with that, I will hand it back, and I'm sorry I went over.
Thank you, Dr. Meek. I so appreciate you and for giving us your time today. And we have lots of questions, but we won't have a lot of time to answer them. So I guess to try to attempt to kind of summarize it, I know lots of their questions could be answered by going to your website, and that's been put in the chat for people to learn more in the various reports. What's coming next for the Children's Equity Project that maybe isn't there now, but is coming soon that we can look forward to?
Oh, we have so much in the works right now. We're doing a whole new set of briefs on discipline that are going to hone in. One of them is honing in on discipline in Black girls that my colleague, Dr. Darielle Blevins, is leading. We're digging into the quality of discipline policies as opposed to just like who has one or who doesn't, right? Trying to get a more nuanced understanding of what types of policies work. So we have a lot of that coming. We're digging into elementary school and kind of radically reimagining kindergarten and the early grades and elementary experience. We have a whole lot on mental health coming up in May. So we have a lot coming out in the next year, I guess.
So it sounds like it's crucial for people to stay connected, keep coming back to the website to learn more, but also there's a lot there for people to dig into. So thank you so much. There's a feedback form in the chat for people to give us feedback today, and this will also be posted on YouTube. So if people missed any pieces, you can go back and find it. And thank you so much for being with us, for your time and for your expertise and your energy. We appreciate you and thank you.
Thank you so much for the opportunity and for being here.